my name is Joyce Gibb. Thanks so much for being with me today. And I have an email from one of the listeners here. So this is from Chris. He said, "Good morning all, hope everything is well. I have a question. I'm a 44-year-old male who has been taking testosterone for 4 months through a doctor after having my blood tested. I was bordering low testosterone, so it was advised to start treatment with anastrozole. So anastrozole is an estrogen blocker. Okay, so it must be testosterone and anastrozole. Because men or women too can convert testosterone to estrogen. So that's what gives the big belly fat, etc. On men too. So through Joe D asked the pharmacist, I also bought a vitamin D plus vitamin K, which is 45 micrograms, and DHEA, as those two were low. So DHEA in men converts from DHEA to testosterone. Testosterone can convert to estrogen. So you do have to be careful about that. Then he says, should I continue using the testosterone treatment as I struggle to sleep at night and I'm concerned about negative impacts later in life? So typically when somebody prescribes testosterone, they usually do a CBC, which is a complete blood count, to check the hemoglobin and hematocrit. High hemoglobin and hematocrit can happen from testosterone supplementation. So I typically check it before the patient starts on it and then like a month or two later. So polycythemia is high hemoglobin and high hematocrit. And typically 18 is the upper end of normal. So we try to keep that down. Why is that a concern? It's a concern because people with high hemoglobin can actually have a higher risk of clots. So you don't want clots in men either. So the other thing I check is a DHT level, because DHT is dihydrotestosterone, and elevated DHT can actually affect the prostate tissue and can change the prostate tissue to be more cancerous. So I always check a DHT level. So what about testosterone and men's health? So testosterone is very protective of the vessel. It keeps the vessel health elastic, like your arteries specifically, and so that you don't have plaque buildup. It definitely helps them be more elastic so they can have compliance. It really reduces overall death, so you don't want a low testosterone for a guy. It stabilizes the mood, decreases depression, and just gives guys an overall sense of well-being. And then another thing it does, it maintains the muscle mass. So testosterone is very good typically for men whenever that's monitored by a provider. And if you need any issues, if you have any issues with low testosterone and libido and things like that, I do testing also. So I'd love to help you maintain your good health as a guy. Even though I'm a female, I help guys too. So make sure you give me a call and I'll be glad to help you. Thanks a lot. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.